I don't intend to speak very long tonight, but I wanted to talk to you briefly about lung cancer and where we stand with it right now, and tell you some of the things that really piqued my interest and touched my heart about it. Will be somewhere between 180 and 200,000 new cases of lung cancer diagnosed in the United States this year. Of that number, somewhere around 160 to 170,000 people will die. Early lung cancer or early stage lung cancer has actually a very good cure rate compared to all lung cancer. If you look at all lung cancer in the United States, only about 15% of it is cured. Early lung cancer, stage 1 lung cancer, has a cure rate somewhere between 65 and 75%, meaning that people are alive and free of cancer at 5 years with those stages if they've been successfully treated, either with surgery or with radiation therapy or with chemotherapy or with a combination of 1, 2, or 3 of those. The epidemic of lung cancer is such that it dwarfs all the other cancers that are present in the United States by comparison. Lung cancer kills more people than the 3 leading cancer killers after lung cancer combined. And that is, as Mr. Morgan mentioned, breast cancer, prostate cancer, and colon cancer. So there is, however, a relative lack of attention, in my opinion, to lung cancer. Why is it that lung cancer doesn't receive the attention that I think that it deserves? Well, we all know why it is. It's because it's generally a disease of the aged. It's also a disease that society and physicians look at as being somewhat self-inflicted. If you remember, we sent our boys at that time off to war with cigarettes in their hand. That was our government that did that. We had very little idea, even on into the early 1960s, of the hugely damaging effects that cigarette smoking does. So I think that the idea that it's a self-inflicted disease is one which everybody bears some brunt of responsibility for, not just the individual patient. What advances do we have to look forward to in the treatment of lung cancer? We have better diagnostic methods now than what we've had in the past. In the 1930s, what did we have? A chest x-ray, and that was it. In the 1970s, we had the advent of CAT scanners, but we really didn't know what we were looking at. We can scan people in such great detail right now that things that were never available to us information-wise in the way of imaging are now readily apparent on CAT scans. Bradford and I sit in a conference every Tuesday with 6 or 8 other physicians, radiologists, pathologists, oncologists, pulmonologists, chest surgeons, all of them experts in the area of chest disease and experts in the interpretation of CAT scans. And you'd be surprised at the raging arguments that we have among each other about what such and such might represent on a CAT scan. 11 years ago, we got a PET scanner. We went to Morgantown, West Virginia, and saw that they had a PET scanner. And at that time, PET scanning for cancer was a relatively new thing. As a matter of fact, it was only approved for lung cancer. We've been able to detect a multitude of tumors, metastases, primary tumors, other cancers other than lung cancers because of our PET scan. In the old days, when PET scanning first came along, we had a CAT scan and we had a PET scan, and we had to kind of compare the two between ourselves. We actually are able to fuse those images right now to where we can overlay the CAT scan on the PET scan and have a great look at what is showing up on the CAT scan and compare it to how it looks on the PET scan, one on top of the other. One of the things that has occurred just within the time that I have been involved with our chest clinic has been the idea that adjuvant chemotherapy, meaning chemotherapy that's given in addition to the primary treatment, which might either be surgery or radiation, has proven itself to give a survival benefit to people with lung cancer. For years, decades, we thought that giving chemotherapy to people with lung cancer after they had been operated on gave them no benefit whatsoever. We have been able to increase survival by 1, 2, 3, 4% in people that previously would have died, even with early stage. As you notice, I said that early stage lung cancer has a survival, 5-year survival somewhere between 65 and 75%. Which sounds pretty good when it's compared to the overall survival rate of 15%. But unfortunately, that means somewhere between 25 and 35% of our patients with early stage lung cancer are still dying. But we've been able to improve that survival with our new and better administered chemotherapy agents. We have other better diagnostic techniques that are on the horizon right now, actually are being used and soon to be here. Endobronchial ultrasound is a way that we can stage lung cancer by which we can actually put a scope down someone's airway without making any incision on them. We can visualize lymph nodes that are not only next to the windpipe but also are out inside the lung, and we can actually do needle biopsies with that bronchoscope of those lymph nodes to better stage patients, give them greater opportunities at what we call neoadjuvant chemotherapy, which means chemotherapy in advance of their surgery, which we think improves survival also. We have better surgical techniques. We have a greater ability to take patients that have marginal lung function, people who have had emphysema or other diseases of the lung that really impairs their ability to breathe, and still get them through major surgery. The final thing that's on the horizon right now is becoming more and more commonplace is the molecular biology and our targeted therapies for lung cancer. In the not too distant future, we will customize therapy for individual patients for their lung cancer based on individual molecular biological characteristics of their own tumor. That's not been done in the past, but it's being done more and more commonly, and it will be standard of care within a very short period of time. And the final thing I would say is this. We really all know what the cure for lung cancer is, and that is to prevent it. And we know how to prevent it. And I would ask that all of you be passionate advocates to eliminate smoking from our kids. We know that stopping smoking is not impossible, but it is so incredibly difficult that once started, breaking that habit is next to impossible. So how do we stop it? We don't ever let it get started. And where do we stop that? We stop it with our kids. We stop it when they're 5 and 6 years old, when they're 7 years old, when they're junior high and high school, and we tell them, I used to tell my kids, I said, you will not smoke cigarettes, ever. Our kids have the benefit of knowledge that our parents, our grandparents, and even we didn't have. So I encourage all of you, be passionate advocates to stamp it out altogether. Let's not let it get started in this new generation. And I would say that is the way that we'll overcome the epidemic of lung cancer.